guys, Mark Zoll here and welcome to my YouTube channel. On today's video we're going to be talking about the medicine that I'm taking post-transplant. So I had a kidney transplant 2 weeks ago now, and I just wanted to go through the different types of medicine that I'm taking and why I'm taking them and how long I'm going to be taking them for. So let's get started. So let's start by talking about my Tacrolimus, my Adaport. I'm taking 6 milligrams twice a day, and this is an anti-rejection drug which is used to dampen my immune system so that my immune system doesn't attack my new kidney. My TAC levels are supposed to be between 5 and 8. At the moment they're at 8.2, which is good, so hopefully I won't have to change my Tacrolimus anytime soon. The next one I want to talk about is my mycophenolate, or my MMF, my second anti-rejection drug. I was taking this before my transplant because I was using it to control my lupus that was in my kidneys, and now I'm taking just a tiny bit more after my transplant to help again dampen my immune system so that my new kidney can be accepted properly. I'm taking 750 milligrams twice a day of my MMF, and that shouldn't be changing anytime soon either because my doctors are pretty happy with the levels of MMF in my bloods already. So I'm also taking a tablet to control my blood pressure, which was high before my transplant, and it's been slightly high after my transplant as well. So I'm taking irbesartan, and I'm taking 150 milligrams twice a day. And like I said, this is hopefully just going to reduce my blood pressure enough just so that it's in a nice range for me. Moving on, I'm also taking alpha calcidol, so I'm taking 0.5 milligrams twice a day of alpha calcidol, and this is just to top up my calcium in my body post-transplant. The next medicine that we're going to talk about is my atorvastatin, so I'm taking 40 milligrams once a day, and atorvastatin is used to control the cholesterol in your body. I take mine at night because it makes me feel lightheaded and a bit weak during the day, so that's why I take mine at night. I'm also taking omeprazole, and I'm taking 20 milligrams once a day of omeprazole. And omeprazole is used just to control the acid reflux in your stomach, which can be produced from taking too many medications all at once. So I'm also taking folic acid. This is just 5 milligrams a day, tiny little tablet, and it's just to supplement the folate that's in my body as well. Now this one's very tricky for me to say, but I'm also taking valganciclovir, which is an antiviral medicine, so it's used just to prevent any viruses that I may pick up post-transplant as well. I'm also taking an antibiotic tablet, which is cotrimoxazole, and this is just to prevent any bacterial infections that I may pick up post-transplant as well because of my dampened immune system. I'm also taking Nystatin, which is an antifungal medicine. I take this 4 times a day. It's just a little yellow liquid, 5 milliliters of it, put it in your mouth, and you just swish it around, and then you have to swallow it. And it just prevents any fungal bacteria and fungal infections building up in your mouth because you're taking so many tablets. The next medicine that I'm taking is called Tinzaparin, and it's an injection. And I take 4,500 units of Tinzaparin. And the point of this medication is to thin my blood post-transplant, because after your transplant you do lots of resting, you don't move around a lot, so it just helps to prevent any blood clots that may form inside your body. I was also taking prednisolone steroids tablets a week after my transplant, so I ended those on the 17th of December. And again, the point of those is just to dampen your immune system to help your body to accept the new kidney without rejection. So as you can see, I'm on lots of medicine after my transplant, but they're not all going to last with me forever. I'm definitely going to be taking my 2 anti-rejection drugs for the entirety of my life, my mycophenolate and my Adaport, and then every time I go to the hospital they're going to be doing checks to make sure that my TAC levels are correct and my MMF levels are correct as well, and they'll change them as and when they need to. I won't be taking the antibiotics and the antifungal and the antibacterial medicine forever. I'm going to be stopping one of them after 3 months, one of them after 6 months, and one of them after 6 weeks, I think. So again, it's just something there to boost my immune system to stop me catching any airborne viruses or viruses from anyone that's sick whilst I'm in and around the house as well. So in terms of pain relief, I'm just taking paracetamol to control any pain that I get. Since my transplant, I haven't been in that much pain anyway. I have been taking it as and when I need to, especially if I've been moving around more than I should have done because my scar starts to hurt me. But I'm not allowed to take anything stronger than paracetamol because it will react differently with my medication, and it could end up in me becoming a bit more ill. So that's all the medication that I'm taking for my kidney transplant. Like I said, it's been 2 weeks since I had my operation. I had it on the 10th of December. And I know that my medication will change throughout the year, so I'll do another update video maybe in about 6 months' time, just to show you how it's changed and what's been increased or what's been decreased or what's been taken away. So if you like what you saw today, please give me a big thumbs up, and don't forget to subscribe to my channel. I'm going to be posting lots more videos over the new year as well, just talking about how I've been feeling after my transplant. I'm also going to be documenting my recovery from where I am now all the way up back to full fitness. So before my transplant, I was running lots. Well, I do lots and lots of running, hence the name of the channel. And hopefully you will be able to follow me along my journey just to see how I go from my transplant back to full recovery and then on to more things as well. I'm going to be doing lots of videos about how to keep fit and healthy and things to eat as well whilst you're a kidney transplant patient, and hopefully I can help you guys out along the way as well, just to show you what I've been doing, just to see how you can improve your own health after your transplant as well.